more tough and strong.
Hey.
Hey!
It takes a cool chiropractor for a patient to be cool around them too.
Oh, stop it, you! You know I'm a sucker for cheap compliments. This is challenging for us today, isn't it?
Yeah.
Here we go. Stilettos are a hazard, people watching, okay? Well, here's a former wearer and here's a doctor. We're saying don't wear stilettos, okay?
It will cause feet problems.
It will. Unless you want to come see me, then please wear as many stilettos as you like. Fatima.
Hi.
Good to see you again. Fatima has very quickly become a regular patient here with me. She is a dancer. She also works at the hospital nearby, so she's a very busy girl. She originally came in, what was the reason again? Do you remember?
It was
low back,
initially
or
lower
was it?
back, yeah.
Okay. And since then, we kind of branched into treating just about every part of the body, neck, upper back, lower back. Fatima, well, again, you had an aggravation, but can you tell us what happened more recently?
Yeah, so I was actually doing back extension specifically was the exercise, and immediately felt my back kind of tweak in one of the extensions, and I couldn't stand up, and I kind of fell to the ground. It hurt to walk, it hurt to crawl. It was really bad.
I remember seeing her walk in here, like, was it like maybe the next day or whenever it was, and like you were actually like hunched over.
Yeah.
I was like, that is not what dancers need to move like. That doesn't work at all. So
no, and then I had to stop dancing for a little bit as well.
I'm sorry that had to happen, but you seem like you're doing better, but it's still there, still bothering you a bit, isn't it?
Yeah, so every time it kind of feels like it starts getting better, I somehow tweak it again. Then
So did you have another, sorry, I don't know this, have you had another tweaking since that one? Or?
Not since last Saturday.
So
the first one was about when I first started seeing you in October.
Yeah, that was originally the original one. Okay,
yes.
yeah. We're filming this in January. Okay,
yes.
So yeah.
And then
you had that other one that flared up. Okay. So since then, you haven't had another flare-up since the most recent. Good.
No.
Now, have you been able to dance again yet, or are you still taking the time off?
Haven't tried it.
Okay. Have you been back to the gym? Have you done more back extensions?
Yeah, I had my first workout this week.
Perfect, yeah.
Took it slow and light, but I was able to do it confidently, and I feel good.
That's good. That's
so
really
far,
good.
Yeah.
Okay. So that's just it. Half the battle anytime we injure ourselves is to just get over that mental hump of we're not going to hurt ourselves again. Okay, so if the exercises are working out, I'd say next week's probably the week to start exploring getting back into the dancing for you. Okay, so that's exciting. That's good.
Yeah.
We also treat the neck and the upper back too. I can't remember you had a neck pain or the history of headaches, or which one was it?
Yeah.
I have a lot of patients, guys, and I always film these at the ends of the day. I promise I'm more organized on paper.
It's always whenever I do my back workouts, my traps seem like they're overworking, and my upper traps get really inflamed. So you were able to help with that fascia work.
Perfect, of course, and we'll probably we will be doing that again today. Perfect. So again, Fatima's a regular patient. We've already done all the examination stuff, so we'll be skipping that. Say we'll be getting right into treatment. Do you have any questions before we get started, or no?
No.
Perfect. All right, we'll get into it. All right, so we're going to be starting in through the upper back now, and then we're going to work our way down into eventually addressing the lumbars, which is Fatima's primary complaint. So already done the neck. Let's work down. You said you did shoulders, right? Mm-hmm. Okay, so. That was my elbow, not her. So Fatima mentioned something in passing just between the two takes here that I found almost kind of offensive. But she mentioned to me that she thinks the reason that she keeps getting lower back pain is because she's got a weak core. Is that right? That's what you told me beforehand, right?
That's what I thought.
Now, I asked where she heard that from. And Fatima, where did you get that kind of concept from, out of curiosity?
I think it's self-diagnosed.
Self-diagnosed, okay. So I always kind of caution against giving yourself self-diagnoses like this, because Fatima being a dancer, okay, and like I just actually had her like brace her core here, and like the obliques, you guys can't feel that, but that's rock solid, okay. So the obliques 9 times out of 10 are always the weakest link in a core. That does not feel weak, that does not feel flaccid, that does not feel untoned to me. That feels strong, okay. And dancers, some of the strongest people with their core that I literally ever treated. So I don't think that'd be the reason. You said that this flared back up when you were at work earlier this week, right? What were you doing while you were at work?
I was just picking a box up from the floor. It wasn't even a heavy box.
No, this was the most recent flare. I'm talking about like when you went back to work recently. Or was that what happened the other day too? Okay, so another box incident. So I'd want to look at the form of exactly how she's doing this, if it's far away, if it's close down. I want to see how heavy this box is, right? I want to see the bracing technique, but I really don't think this is because of a core insufficiency issue. And I always caution people, it very well could be, but I always caution people about self-diagnosing without having an exam. Anyways, I can get you to take a breath in here for me, all the way out. There we go. More breath in. All the way out. There we go. Actually feel okay. There's a little one right there. Breath in. All the way out. There we go. That was a good one. All right. And into the lower back. Left side, right side, or dead center?
Center.
Center? Okay. So Fatima, like I mentioned, is a vet. She already knows the right position for this. So you're already there. I'm actually just going to get you to put your hand on your elbow. Perfect. And hips a wee bit closer. Thank you. And you just relax in that position. Perfect. Big breath in. All the way out. All the way out. There we go. A little stubborn today. We'll get you on the other side, please. Thank you. Got this. Perfect. Hold right there. Nice. Breath in. All the way out. Wow, this is challenging for us today, isn't it?
Yeah.
Here we go. Make me work for that. Good job. Okay. And then, so Fatima's had her neck worked on and adjusted many times, so she's quite comfortable with this at this point, right?
Only if you do it.
Ah, I'm flattered. I'm very flattered at that, yeah. Anybody else? Other chiros, stay away, please. Job security. So you said you were able to get back to a workout recently. Was that a back workout, or what was that for you?
I did shoulders, triceps, and core yesterday.
Yesterday, okay. So shoulders, how are the traps feeling as a result? Are they okay?
Sore.
Sore, okay.
Yeah.
Well, that's fantastic. We will get to those for sure. Only better. Were you nervous the first time you had your neck done? I can't even remember now.
You were talking to me, and I had no idea that you were going. Like I had consented to you
I was about to
adjusting.
say, you knew that I was going
Yeah.
to. Yeah, I want to clarify that.
Yeah.
People watching.
Yeah, I just didn't know that it was going to happen
happened.
that moment,
Right,
and you
yeah.
did it really smoothly.
Thanks. I've done this once or twice. Alright, so yep, we're going to be in that position there. Love that, yeah. Well done. Yeah, there was no tensing up whatsoever there, so Fatima was definitely a vet at this point. Good job.
Is it normal for people to try to tense when you're adjusting?
A lot of people sometimes will get nervous, of course, and of course when you get nervous, the traps shrug on up, and that can cause some guarding, and that makes it harder for the chiro, obviously, because they have to push through that muscle. A lot of chiros, if they're not really experienced at adjusting too, when they try to position someone, they'll go like way too far over like that, and that just makes it uncomfortable, right? So if it's uncomfortable, again, you tense up. So it's not ideal, but it's quite common, right? And it's on the practitioner to try to get around that, such as surprising the person, which is the very first thing I did with you, right? So, all right, good job. Fatima's a very big fan of the scraping that we do here. Yeah, she's nodding her head there. So to that end, of course, we're going to be including that in any kind of treatment plan with her. It's important to make sure you abide to patient wants within reason. Of course, there's sometimes they want something that's actively harmful, but this can be beneficial, especially if we're dealing with a muscular complaint. So we'll get started here. Now, usually, Fatima, at this point in time of the video is when I ask people to kind of talk about themselves a little bit or share some backgrounds, because again, and I say this pretty much every time, a big thing we go for on this channel is authenticity. These are real people. So Fatima, there's kind of two things we touched on that you might want to talk about, but like, which do you want to go first? Because I know she's got some accomplishments in her background, but also a current job perspective or a career pathway towards something she's proud of too. So,
well, I guess so. Where I work now at the Oakville Hospital is in mental health and addictions. I've been doing that for about 7 years.
That's a long time, actually.
Yeah, I love my job. I love the patients. I love like seeing the transformations in their mental health, and like some people come in super unwell, and just seeing how they get better over time is really rewarding. But
I fully get that too.
Yeah. The healthcare field in general is just rewarding.
100%. It's also quite difficult some days, but you know, for the patients,
your patience.
Oh yes, it really can. But not to any of you guys, of course. You guys are great. But no, sometimes it really can. But it's good to hear that's the case with you. Can I ask how you fell into the mental health and addiction specifically, or is that like a personal question? Or
when I was in college, we actually got assigned our placements.
Okay.
So this is where my placement was.
Okay.
And they hired me right after.
Oh, look at that.
Yeah.
You're that wanted.
Yeah.
Hireable. Good job.
Yeah.
At a time where everybody's struggling to find a job.
Yeah, actually, I've been the only student since then that the department has hired.
So you must have actually been exceptional, if that's the case, because they wouldn't just do that and then never do it again, right?
Yeah.
So be proud of that. Well done.
Yeah, and it was about 4 or 5 years ago, and I felt like there was just a little part of my life that was missing. And growing up, I had always wanted to do modeling, but never really ventured out, and never thought I'd be successful at it either.
So you are a former successful model, then, yeah?
Successful, depending on who you ask.
Success is in the eye of the perceiver, I guess would be the case.
Yeah.
I think I'm a successful chiropractor.
Yeah.
Depends on who you ask. But, so then, no, that's good. So you were a model for how long then?
I did it for 2 full years. And
2 full years, okay.
It was like my work at the hospital Monday to Friday, and then I would do modeling like in the evenings and weekends. So I basically never had a day off.
That sounds
just
kind
grind.
Yeah.
And that might be a part of why I stopped modeling, is because I found it more exhausting at that point.
Yeah.
But it was still a lot of fun, and I'm really glad that I was able to put myself out there and try something new, and make great connections.
Good on you for doing that. I know that probably takes an insane amount of confidence to do, and if you don't have it at the start, you got to fake it till you make it.
Oh,
right?
and that's exactly what I did. Yeah.
I have a handful of model patients, and they've all kind of said the same thing, like when they were starting, unless they were like really young and they didn't know what they were doing yet until they kind of grew into it. Like it was getting started for them was always a challenge, but then hey, it worked out up until they eventually found a different path, right? But
and if it wasn't for all the positive feedback from creatives that I was working with, I might not have continued doing it, but people were just so supportive, and Yeah.
That's really good to hear, because you'd think with the modeling industry you hear like the nasty things, but you probably don't hear, unless you're in it, too many of the positive things. But
And you have to be selective with who you work with as well.
like in what do you mean?
Just ask around if people are reputable and do your research before you work with a photographer.
Okay, I think I get what you're saying. Yeah, that's important. Always do your research with everything, guys.
Yes.
I think that's the most important thing. Yeah.
Yeah, it was a humbling experience. I remember my first runway. I was wearing these massive stilettos.
Oh boy, that sounds like ankle problems.
Yeah.
That sounds like.
Yeah.
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 Did you fall?
I fell.
Oh no!
But I kind of fell and like tried to save myself and make it look like it was a natural
Oh, it's
fall.
just style. Got it. Yeah.
Strike a pose when you fall down.
Oh my god. Well, hey, it wasn't your last runway though. So
No.
Good.
Yeah.
Couldn't have been that bad of a fall if that's the case. Glad you didn't break your ankle. Stilettos are a hazard, people watching, okay? Don't ever wear them if you can avoid them.
I don't recommend them.
Well, here's a former wearer and here's a doctor. We're saying don't wear stilettos,
Yeah.
okay? There you go.
They will cause feet problems.
It will. Unless you want to come see me, then please wear as many stilettos as you like. That's fine. Yeah. So we got a little bit of that petechiae forming right here, but most of it seems like it's been cleared up since you first came in.
The redness?
The redness, yes. We might, in a bit, get you sitting up and go with the traps there. But right now, let's focus back down on the low back.
So is there less redness because my back is used to it, or because there's not as much of the fascia?
The fascial adhesions, yeah. So the redness, what it is, it's technically a microbleed. Okay, you're bleeding, technically. That occurs after we have broken up a formed adhesion within fascial tissue. That's a really complicated way of saying we've loosened things up. Okay, so once we do this with enough frequency, eventually the fascia is healed, it doesn't adhere up as much, so we get less of that redness. Okay? So it's a good thing. Like, seeing the redness tells us we're on the right track. When it starts to disappear, it tells us we've had the effects that we want, right? So to that end, we'll always get it coming back the same way we'll always develop muscle knots, but it's just part of life, right? If you want consistent output, it requires consistent input. So that's where the whole proactive wellness care comes in that I talk to pretty much all my patients about. It's your decision, but I would of course advise you see some form of manual practitioner on a regular basis. Doesn't have to be me, but it should be someone.
That feels so much better than it did a week ago.
Oh yeah.
Or even like 3 days ago.
Yeah. No, when Fatima came back in after the most recent flare-up, if I did this, she probably would have tried to, like, spike me with her heel back here. Like, she would have just absolutely tried to kick my jaw out. But now, I appreciate you keeping the legs on the table. Please don't hit me. Yeah. I'm a very fragile person. Delicate flower. Ooh. A bit more down here, and then we'll change positions.
Is it normal for your stomach to grumble when you...
It is after you just had what was it called?
Menaquiche.
Menaquiche?
Menaquiche.
Menaquiche. It's normal for your stomach to grumble right after you just had menaquiche. Yes. Yeah. Guys, you can Google that one. Apparently it's Arabic pizza. I'm learning new things every day.
So good.
Menaquiche. Yeah, that's what it is. But no, you got some stomach grumblies. Granted, you do have your stomach kind of right where I'm pressing. Well, not really right. That's more of the intestines. And we got some good amount of muscle in the way. But like, if anybody's going to work the abdomen after you eat, yeah, you might get a little bit of grumbling. So. Okay.
Should have brought some for you.
You know what? I was thinking that, but I didn't want to say it because I didn't want to make you feel bad before we film. It's okay. It's always next appointment. I'm kidding, of course. You don't need to bring me medication.
I will now.
You will now, eh?
Mm-hmm.
Okay, well now we don't hold you to it. Yeah, so Fatima's got a lot of hair, which is it's really nice hair, but sometimes it needs, yeah, there you go. So I don't want that to come down. I want that to be just like that. Perfect. So if I can kind of wrap around there we go. I can do this here. So you were saying your traps are feeling more sore than your shoulders were?
Mm-hmm.
Even when you're doing the shoulder workouts?
Even when I'm doing a shoulder workout.
Oh, man.
Is that because maybe...
So that to me suggests that we might need a form check on what we're doing, because if your traps are absorbing most of the shoulder work, that's not ideal. So what kind of shoulder exercises are you doing when you are in there?
Mainly just shoulder press with dumbbells and on the machine.
Okay.
And
so
lateral
you're combining
raises.
it. That's good.
Mm-hmm.
And lateral raises. Okay.
Yeah.
So I'd be curious as to how you're doing both of those, because those can very easily become trap-dominated exercises unless you consciously keep the shoulder depressed while you're doing it. Keep the shoulder low. If you can do that, that's going to ensure you're using the deltoids more so rather than the traps, because the deltoids, they don't bring the shoulder up, okay, or they don't hike the scap. They move the actual humeral head or the arm around the shoulder. But yeah. So after this, I can grab you some dumbbells and we can do a form check.
Okay.
Yeah.
Treatment. VIP.
Oh, yeah, exactly. You and anybody else that complains of shoulder issues related to exercise.
Yeah.
Getting a little bit of redness in through there. Again, the redness can be harder to see on darker skin, so that's why it's a little bit harder to pick up on Fatima here. But it's definitely there. I don't know if you guys can see it on camera, kind of, but I can definitely see it with my eyes here. Good. So is that tender as I'm working through there?
Mm-hmm.
Yeah, okay. Well, we'll give that a break and we will switch the sides. Move the camera now. Will this actually go over like that? Perfect. And we'll go here. And I'm going to kind of come around here. Good. Bring this back up and move this over just an inch. There we go. Intense, huh?
Yeah.
You were tough and strong. In case no one's told you yet today, you were tough and strong.
Hey.
Hey! Guys, I love my job. This is a fun job. Yeah, if you're ever thinking about being a chiropractor, go shadow some. It's a fun time. Yeah. Mm-hmm. I guess that's actually dependent on the people. Those the patients. If the patients aren't cool, then it's not going to be fun. But if the patients are cool, then it's a good time.
It probably takes a cool chiropractor for a patient to be cool around them too.
Oh, stop it, you! You know I'm a sucker for cheap compliments. Stop that.
It's true.
Yeah, no, it's important that you find practitioners that you feel listen to you. That's probably the most important. Well, the most important thing is that they're effective. And then important thing number 2 is that they give you time of day and you vibe with them. I really do think that if you can develop a good relationship with your practitioners, that's going to pay off in dividends in the long run. To that end, I need a new medical doctor.
Oh yeah, the whole reason I kept coming back was after our very first session. The next day I was like, whoa, recovered.
I remember that actually.
Yeah.
It was pretty dramatic. It was
Yeah.
pretty dramatic transformation. So I'm happy we were able to help you out. Yeah. Also, Dr. Agarwal, that was nothing personal at you. Okay, like I like you. I really do. It's just I miss you. Maybe it's because I haven't seen you in a while. That could be it. Yeah. Anyways. Kind of as I work in through, yeah, that still feels like a little bit of a guitar string. You're allowed to cry. It's fine. Don't worry about it. Good.
I will not be defeated.
Not on camera. Actually, it doesn't feel too bad. I think it's calming down. Alright, good stuff.
You're gonna get me to my pull-up goal this year.
Your pull-up goal is 3? Was it 3?
Oh, 1.
1? Oh,
1.
Somebody had a pull-up goal of 3. I thought it was you.
No.
Might be somebody else. But pull-up goal of 1? You can probably do that right now. Actually, willing to bet. Fatima, how did you find? We just finished up the appointment for today. We just finished a form check on the exercises, and we're gonna see if we can do the isokinetic machines going forward. But I'm getting carried away. I do this. How did you find the treatment today?
So good. I feel super mobile right now. A little tense in here, but that's expected.
Yeah. So I'm sorry. Were you gonna keep going there, or did I just?
No.
I've been told that I interrupt patients a lot, and that's bad. You don't want to do that. But again, since you have just worked out and you are quite tense there, we can expect that tension to persist for another couple of days, but it's going to clear out the same way that it always has. Now my stomach is growling. I don't know if you heard that one, but I think it's time for me to go eat too. But no, so again, really happy you're able to free things up, and I'll be here for you next time too. Do you have any questions, comments, concerns? Is there anything else that you want to talk about for today, or no? You asked a lot of questions already.
Yeah, I did get all my questions out. I guess I'm also just like self-diagnosing and wondering if my posture now is a reason for a lot of my back pain.
Yeah,
it's like poor posture.
Entirely possible. I always say that the worst posture you can remain in is whichever posture you've been in for the past 5 hours, right? So to that end, movement is the best thing you can do for that. I know you said that when you were sitting down at the hospital for after a few hours, your back was killing you. Right?
After 5 minutes.
After 5 minutes, I take that back. After a few minutes, not hours. My question is what's the chair or the stool you're sitting on? Are there other chairs and stools you can sit on for longer than 5 minutes? You're fine. You've been sitting here for 5 minutes. Are you okay in the low back?
Yeah, I just had a great treatment.
Well, that's a good point too, right? So there's a confounding variable there, but I always wonder when somebody, for instance, I get low back pain when I sit in my chair at home because I'm too cheap to buy a new one, right? But on my stool here, which has no back support at all, I'm totally fine, right? So it really does, if somebody thinks it's because of a weak core, but they're really only getting the pains creeping up when they're sitting in a specific location, change up what you're sitting on, because it's more likely faulty equipment than it is faulty you, all right? I don't think you're faulty with that, okay? Or anything for that. I'm not going to knock on wood after that one. Yeah, but good thought. When it comes to posture, just keep changing it. Okay, if you can shuffle or shimmy around people who fidget, less likely to get those postural complaints as compared to people who don't. So, Okay. Any other thoughts? Anything else you want to talk about for now?
I think that's everything.
Good,
Thank you
awesome.
So much.
All right, so Fatima, it was great seeing you. Thank you again for coming in.
Thank you.
And see you soon.
Don't forget to like, comment, share, and subscribe.
Thank you, Fatima.